Hello guys, welcome and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS, Simplex and OET training. So நம்ம பார்த்துட்டு இருக்கிறது மேஜிக் பில் செஷன். ஸோ எவ்ரிடே MCQ சீரிஸ் வந்து உங்களை வந்து ரீச் ஆகிட்டு இருக்கு. ஸோ நீங்க பண்ண வேண்டியதான் இந்த MCQ சீரிஸை பார்க்கணும், சேனலை சப்ஸ்கிரைப் பண்ணணும். பிடிச்சிருக்கு, யூஸ்ஃபுல்லா இருக்குன்னு நினைச்சீங்கன்னா மற்றவங்களுக்கு ஷேர் பண்ணுங்க. ஸோ அதனால மற்றவங்களுக்கு இது வந்து யூஸ்ஃபுல்லா இருக்கும். ஸோ இப்போ நம்ம என்ன செஷன் பார்க்க போறோம் அப்படின்னா, நேற்று நீங்க பார்த்த செஷன் வந்து லாஸ்ட் நம்ம பார்த்த செஷன் வந்து ஓஜி. ஸோ இப்போ நம்ம பார்க்க போற செஷன் வந்து கம்யூனிட்டி ஹெல்த் நர்சிங்ல இருந்து லாஸ்ட் ப்ரீவியஸ் இயர் கொஸ்டின் பேப்பர்ஸ் வந்து நம்ம டிஸ்கஸ் பண்ணிட்டு இருக்கோம். ஓகே, ஃபைன். ஸோ த ஃபர்ஸ்ட் கொஸ்டின் இஸ் த நர்சிங் கேர் ஃபார் த retro positive patient with molluscum contagiosum. This secondary infection is caused by. So எப்பவும் போல key points. So இதுல என்ன key points பாத்தீங்க அப்படின்னா, retro positive patient so with molluscum contagiosum. Okay, so இதுதான் key points. This secondary infection is caused by அப்படின்னு சொல்லிட்டு 4 ஆப்ஷன்ஸ் கொடுத்திருக்காங்க. Pox virus, papilloma virus, Epstein-Barr virus and Herpes simplex virus. So these are all the 4 options. So among these the right answer is option A, that is Pox virus. So why we selected Pox virus? The rationale behind this is molluscum contagiosum. You should know first what is molluscum contagiosum. It is caused by the pox virus, occurs mainly in children. So 2 vital points over. Caused by the pox virus and occurs mainly in children. Fine. The next important thing is the characteristics of the lesions, because that is very, very important. Either they will be giving the image and they will be asking what type of lesion is that. Otherwise, they will be giving the wordings of the lesion, like that is pink color, doom shape, waxy papules. What kind of lesion is this? In which disease condition you can see this type of lesion? So this is how they will be asking the questions. So here these 2 vital points, whatever I have mentioned, is very, very important. So this is a lesion which is benign, pink color, doom shape. It is a doom shape. Okay, and waxy papules. Waxy papule means the white color pustules will be present with the central umbilication, means that is a mole will be present in the center, a depression will be present. Okay, so that is called as what? Central umbilication. You can see the image so that it will be easy for you to understand. So it is doom shape, waxy papules. You can see the waxy papules here. Okay, white color papules, and in the center there is an umbilication, that is a depression is present. Okay, fine. So this kind of lesions are present means it is because of what? Molluscum contagiosum, and it is very commonly seen in patient with retropositive as a secondary infections. Is that clear, guys? Fine. So other infections are also mentioned here, that is human papilloma virus, Epstein-Barr virus, Herpes simplex virus. All are because of what? Sexually transmitted disease. Okay, fine. The next one is characteristics feature of a zoonotic infection. See, first direct question. Zoonotic infection means from the animals and it is coming to the humans. That is called as what? Zoonotic infection. And they have given 4 options like Vincent angina, swimming pool granuloma, malignant pustule and carbuncle. So by giving this 4 options and they are asking which is the zoonotic disease, and here the answer is option C, that is malignant pustule. There is another name for malignant pustule. If you know that, it will be easy for you to understand. So this is how they will be asking the options, guys. Instead of malignant pustule, if the option anthrax is there in option C, means might be directly would have been tell the answer. But instead of anthrax, what option they have mentioned here? Malignant pustule. This option is mentioned here to make you confused. Okay, so you should know malignant pustule is also the other name of anthrax. Okay, malignant pustule is also the other name of what? Anthrax. So if you know these things, easily you can go for the answer option C, that is malignant pustule. Okay, fine. So here you can see the rationale. Anthrax, it is also called as malignant pustule, as I mentioned already. It is a zoonotic infection caused by the gram-positive rad Bacillus anthracis. Okay, the organism name is Bacillus anthracis. It is a zoonotic infection. It is also called as anthrax, is also called as malignant pustule. And these are all the first key points. The second key points are how it will transmit, where it can show the lesions. See, anthrax, it can show its lesion in the cutaneous, that is in the skin. You can see the lesions. Mostly 95% of cases where the lesion you can see the lesions in the cutaneous. The remaining cases, that is inhalation. Okay, the spores are inhaled and the person will be having shortness of breath. the last 1%, that is less than 1% GI symptoms. Okay, so 95% the anthrax is showing the signs and symptoms in the cutaneous, that is in the skin, in the form of lesions. I will be showing the image also, don't worry. So you can see very clearly the lesions of the anthrax. Okay, so edema will be there, pustules will be there. So in the center, this kind of discolorations will be there. Okay, ulceration will be there. You can see the ulcerations. Okay, so if this kind of lesions are present, means you can consider what? Anthrax. Okay, so 3 types of anthrax infections I have mentioned already, that is cutaneous, inhalation, and GI, right? So cutaneous is most common, that is 95%. So cutaneous anthrax, it is also called in so many names. That's why I added this slide. Please listen carefully. See, cutaneous anthrax, it is also called as malignant pustule. This point already we discussed. It is also called as what? Black eschar, because the lesion, it is like a eschar tissues, dead tissues. Very difficult to remove it. Okay. The next one is wool sorter disease. It is also cutaneous anthrax is also called as what? Wool sorter disease or rat picker disease. Okay, fine. And this organism gain access through the cuts. Whenever there is a cut injury, immediately the organism will enter inside and it will create the infection. Okay, and the next one is inhalation anthrax. The spores which is inhaled inside and it will cause the respiratory distress and death. There is no much point because only 5% of people are getting affected by the inhalation anthrax. And the last one is gastrointestinal. That is less than 1% of people are affected by gastrointestinal. That is usually fatal, acquired by ingestion of the contaminated raw meat. If the person is eating raw meat, means it is not boiled or cooked properly. Okay, so this kind of meat, if the person is eating, means they will be having the chances of getting the gastrointestinal anthrax. Okay, fine. So these are all the key points what you're supposed to remember. Hope each and everything we are discussing clearly, guys. So what you're supposed to do is please follow us, understand the concept. If you have any doubts anywhere, drop your message in the comment section, so we will be answering your questions. The next question is, while assessing the client with a history of genital herpes, first key point, which of the following symptoms would indicate that an outbreak of lesion is imminent? Outbreak of lesion is imminent. Second key point. Okay. So 4 options they have given here. They have given the signs and symptoms like headache, fever, vaginal and urethral discharge, dysuria, or lymphadenopathy, genital pruritus, and paresthesia. Among these, the right answer is option D, that is genital pruritus and paresthesia. See, 2 types of herpes simplex virus we are going to discuss now. Very, very important point. First point is very, very important. So herpes simplex virus 1 and herpes simplex virus 2. If the person is affected by herpes simplex virus 1, mostly the oral lesions will be there. The lesions you can see in the mouth. Whereas on the other hand, herpes simplex virus 2, it typically causes genital lesions. Okay, pruritus will be present. Before the development of the lesions, paresthesia will be there. Okay, before development of lesions, what will be there? Paresthesia will be there and pruritus will be there. Okay, so these 2 options are mentioned here in option D. That's why we selected option D as the right one. And the characteristics of the lesion is red, painful blisters will be appear in the genitalia. Okay, if it is coming in the oral mucosa, there also red, painful blisters will be there. Okay, guys, so local pain, pruritus, tingling sensation, burning, dysuria, uncomfortable sensation like paresthesia, all these symptoms will be present for the patient who is suffering from HSV, that is herpes simplex virus. Okay, obviously it is a sexually transmitted disease, and gold standard diagnosis for diagnosing this disease is tissue culture. So all the 4 points which is there in the rationale is what? Golden points. Okay. And the next question is, all of the following are associated with increased chance of acquiring HIV infection in women, except. So increased chance of acquiring HIV infection in women, that is the key point. And they have given 4 options like chlamydial infection, bacterial vaginosis, herpes simplex, trichomonas vaginalis. And here the right answer is option D, that is trichomonas. Okay. So why we selected this option? The rationale behind this is, the risk for acquiring HIV infection is 6 to 10 times high in the person with sexually transmitted disease. So now you should know what are all the disease which is coming under what? Sexually transmitted. It is also called as venereal disease. Chlamydia, syphilis, gonorrhea, charcoid, trichomonas vaginalis, herpes simplex infection. All these diseases are coming under what? What? Sexually transmitted disease, and very commonly seen in HIV infection. That is 6 to 10 times higher in person with HIV. Okay, and other options like bacterial vaginosis. Fine. See, a small correction, guys. Here the right answer is option B. It is not option D. Okay, so here the right answer is option B. Bacterial vaginosis is the right answer. Which is the right answer here? Option B, that is bacterial vaginosis is the right answer. Option D is not the right answer. Option D, that is Trichomonas vaginalis, is also sexually transmitted disease. So that is not the right answer. Which is the right answer here? Come on. Option B, that is bacterial vaginosis is the right answer. So bacterial vaginosis, why I am saying it is a right answer? Because here the question is except question. Okay, so bacterial vaginosis is a non-sexually transmitted disease which is caused by Granulella vaginalis, which mainly affect the lower genital tract due to the disturbance in the normal vaginal flora. It is not a sexually transmitted disease. Whenever the normal vaginal flora is disturbed, so that time there is a chance for getting what? Bacterial vaginosis. And once the patient is affected by the bacterial vaginosis, what will happen? The creamy white discharge with fishy discharge will be there. Okay, guys. So for this question, there is a small correction. The right answer is option B, that is bacterial vaginosis. Okay, fine. The next question is the virus in Kasor forest disease affect. The virus in Kasor forest disease affects. So this is the question. This question asked in JIPMER examination. So pig, monkey, cattle, man. So Kasor forest virus disease affect which among these four options? This is how you have to understand the question. Kasor forest disease virus affect which among the following person? Pig, monkey, cattle, man. Among this, the right answer is option B. That is monkey. See, Kasor forest disease, it is also locally called as monkey disease because it is transmitted from the dead monkey. Underline the keyword dead monkey. Okay, fine. So it is a serious disease first identified in the Kasor forest of India. Okay, so it is mostly transmitted by the ticks. Okay, hot ticks. The name of the tick they have mentioned here. This is also very important for your exam. Hemophysalis spinegria. Okay, it's spread from animals to humans. Mostly it is spread through the monkey and rodent. Rodent means rat. Rodent means what? Rat. Okay, let me show with the image so that it will be easy for you to understand. This is the cycle of the infection. So the tick, from the tick, the larva, the egg is coming out. From the egg, the larva is coming out and it is entering inside the animals like rat and monkey, and the monkey is getting death. From the monkey, from the dead monkey, if any person is frequently visiting the forest, okay, for example, the tribal peoples are there, they will be frequently visiting the forest area, right? So these kind of peoples, they will be seeing the dead monkeys. If they are coming in contact with the dead monkeys, means easily the infection will spread to the human being. For the cattle, there is a less chance for getting the infections, but for the rodent and monkey, it is very, very common. Okay. The last question is the vaccine for yellow fever is, they have given four options. Direct question, Salk vaccine, 17D vaccine, CCEEB vaccine, PREP vaccine. Among this, the right answer is option B, that is 17D vaccine. Okay, so it is the 17D strain vaccine is approved for yellow fever. Yellow fever is very, very common for in the African countries. If you want to go to the Africa, any countries in Africa like Zimbabwe, Ethiopia, whatever the country, South Africa, if you want to go, means you have to take what? Yellow fever vaccine. So here the dosage is very, very important. 0.5 ml subcutaneously they are injecting the to the person. The immunity will develop within 7 days and last for lifelong. But still, every 10th year, the WHO is recommending for the revaccination. Okay, so those details also mentioned here. So guys, hope these contents are very much useful for your upcoming examination. Thank you very much for watching this video. So keep on watching the Metier International Academy, e-nursing Metier YouTube channel. We will be posting and publishing this kind of magic pill MCQ session every day morning. Okay, so please subscribe to the channel and keep watching us. Develop your knowledge. Instead of saying developing your knowledge, update your knowledge. It will be very much useful for the upcoming examination. Thank you very much for watching the videos and all the best for your upcoming examination, guys.